Fun time of the agenda because we're going to announce the winners of the poster session from this morning. So I'm going to turn the podium over to Jessica Pinchman-King to make those announcements.
All right, thank you all. What a great poster session this morning. The ideas, the concepts, and the findings from the posters have really sparked some great conversation and next steps in terms of new project directions to pursue. I have the tallies from the judges' scores, and I would like to announce the poster frontrunners in each of the 4 categories. When I call your name, please come up to the stage to receive your small monetary award. Okay, so for the research category, we have Danica Joseph, and the poster was presented by Jeremiah Rastegar, and they are from the Birmingham AIDS Outreach and UAB. And their poster was entitled Artists, the importance of reducing barriers and supporting re-engagement in medical care for HIV-positive individuals. Thank you. Good job, Danica. Our next category was Advocacy Initiative. And the winner from this category is Sheila Tyson and Kelvin Doucher from the Friends of West End Incorporated. And the title of their presentation was Education to Action, Supporting Youth Leadership Through Environmental Health Education. Thank you. Our third category was professional skill development, evidence-based services, and other poster presentations. The winner from this category is Miss Sunny Slaughter from Sunny Slaughter Consulting, whose poster was titled Defining the Role of Minority Health, Response to Human Trafficking Victimization. Our fourth and final category was program evaluation and conceptual framework. The winner from this category is Miss Rika Abbott from the UAB School of Public Health. Are you here, Rika? And the title of her poster was A New Framework to Capture Social and Behavioral Determinants of Care, Bridging a Patient, Clinician, and Community-Centered Model to the Entire Stroke Belt Region. all of our poster presenters did an excellent job, and we have certificates for everyone who presented a poster. We are now entering the afternoon portion of our agenda. Before I introduce Mr. Al Richmond, our lunch speaker, I would like to remind each of you to please complete the evaluation form that's in your documents. It was in between your agenda for the day. We really want you to thoughtfully fill that out so we can get some feedback to assist us in our planning of the event for 2016. There are boxes where you can drop off your evaluations at the registration desk. In addition, Jessica Wakely, who's in charge of that part of the CEI, will be walking around, and she'll also have a box for you to fill that out. So even if you're not staying till the end of the day, we really would like for you to complete your evaluations. So I have the distinct pleasure of introducing our afternoon keynote speaker. Al Richmond is a social worker and public health advocate that has worked within the racial and ethnic health disparity space for over 25 years. Mr. Richmond is a founding member and past chair of the Community-Based Public Health Caucus and the National Community-Based Organization Network, both affiliated with the American Public Health Association. He has also worked both locally and nationally to advance community engagement in health research, in particular through the National Institutes of Health's Clinical and Translational Science Award Program. Originally from Charlotte, North Carolina, Al has lived in Raleigh for the past 25 years. Please join me in welcoming Mr. Al Richmond for the 2015 Community Engagement Institute keynote speaker.
Well, good afternoon, and please feel free to continue eating. I have. And so it's certainly a pleasure to be here. And Shauntice kind of set me up with this one in terms of, I feel like Dr. Davis was your morning speaker, and he was just phenomenal. So let's just give him another hand. I was like, that is so unfair because I have to talk and people are eating and all of that. So I feel like I may have to be a little bit more entertaining and more engaging. So I want to say how thankful and grateful I am for the opportunity to be here today and to join you at the University of Alabama, Birmingham for your second Community Engagement Institute. And I think that you are on the way to really creating kind of a phenomenal presence in this community annually through this particular event. I think about the UNC Minority Health Conference, which gains a lot of attention, and some of you may have kind of tuned into that on an annual basis, but I really, as I was sitting there, I was just kind of thinking about you're really on your, kind of on a trajectory towards creating a similar model here, and that would be phenomenal. I think they usually have about 1,000 people in attendance every year. And you're certainly on your way to doing that if this is any indication. But when I talk about next year, Shauntice is like, just let me get through this year, and we'll talk about next year sometime, and not this year. I want to also recognize Dr. Max Michael, the Dean of the UAB School of Public Health, and we've had an opportunity to talk a little bit, and I'm looking forward to exploring opportunities to partner with UAB and other institutions in the region to expand the work of community campus partnerships for health. I would feel very remiss if I didn't also acknowledge those that have gone on before me in terms of really laying a foundation for the opportunity that I have to serve as the Executive Director of Community Campus Partnerships for Health, but also to be present today to share some thoughts and ideas with you. Again, I just want to say I commend the Planning Committee, those of you that have been part of this work. It's a lot of work, so I hope that you will be able to get some rest this weekend and enjoy yourself, because I know that there's a saying I learned years ago, about 20 years ago, and the saying says, you choose when you sweat. And what it means is that it's always better to sweat on the front end than trying to sweat during the process. And so I don't think any of you are sweating today because your work reflects the fact that you made the decision to work really hard on the front end, put in a lot of hours, a lot of time, and today you can kind of like enjoy yourself and reflect on the fact that you have done a job well done. This has been a really, thank you. This has been an amazing week for me. I've been on the road since I came actually into Birmingham on Sunday. And I wanted to take advantage of this opportunity to visit not only Alabama, but Mississippi as well. So about a year ago, I started as the Executive Director of Community Campus Partnerships for Health, and I'll talk a little bit about that in a minute. And one of the priorities I have is to really expand our reach and our presence in the South and the Deep South. I am a Southerner, and I'm committed to making sure that our work really does reflect the engagement, the full engagement of academic institutions and community partners in this region who are doing some exemplary work. As a Southerner, I'm very defensive of the South, so don't say anything bad about sweet tea. I'm very defensive, and I want to make sure that I do everything that I can as the executive director to make sure that academic institutions are involved in our work, and we're connecting and we're building partnerships. It's interesting, we talk a lot about partnerships, and I'll go into what we call our principles of partnership, but partnerships don't just include working relationships or partnerships between academic institutions and communities, but they also include partnerships between academic institutions and nonprofit organizations and groups like ours, also partnerships between one academic institution and another. So as I said, this has been an amazing week. I started on Sunday morning by doing something that I'd always wanted to do, and that was to visit the historic 16th Avenue Baptist Church. And that was very moving for me as I reflect about that incident that occurred one Sunday morning some years ago. And I wanted to honor the memory of those young ladies that were killed in that experience. I left Birmingham and then went on to Mississippi for a 3-day visit and had the pleasure of visiting some great people at Jackson State University and Tougaloo College. And yesterday, to put some more layers on this, I had the opportunity to visit Tuskegee University, which again was something that I always wanted to do. And it was just so moving to walk on those sacred grounds and to think about the vision of Booker T. Washington and George Washington Carver, and to see statues and to visit and to pay homage to them. And I just thought about how amazing they were and the fact that they had such vision to see ahead, to create an institution that would really serve to advance not just blacks in America, but all people. And if you haven't read the life of George Washington Carver, it's just he was just an amazing person who gave everything he had for other people. And I was sharing with them that if Dr. Carver had actually patented all of the things that he had created, that Tuskegee would probably be one of the most endowed schools in the United States. Because when you think about all the products that have been generated from a simple peanut, all of the vaccines, all of the food products, all of these things, but he was such a selfless individual. He gave so much of himself, and you really feel that when you visit Tuskegee. And so I was really pleased and honored to be able to do that. And then to come here today at the University of Alabama, Birmingham, to visit you for your Community Engagement Institute. It really kind of puts the icing on the cake, if you will. So at each stop in this visit in the South or the Deep South, and so I think about the South, but one of the terms I've really come to appreciate is people from kind of Mississippi and some regions of Alabama and Arkansas talk about the Deep South, that there's a more different experience that occurs in the Deep South. And it was an eye-opening experience for me to look at the transition, to look at the progress and look at the development, but also to visit community-based organizations and academic institutions that are working in partnership with each other and across race and class and all kinds of differences that there might be, to facilitate meaningful partnerships. I visited in Jackson, I visited the Medical Mall, which is a renovated mall that's been turned into a one-stop health center that's absolutely phenomenal. And I was blown away because not only could you go in there, you get services, OBGYN services, WIC services, the public health department. You could get immunizations done there, but also the new School of Public Health at Jackson State University occupies the first and second floor. And there's so much that's going on, and I thought about, wow, this is really about addressing health disparities, because it's not about just about addressing the physical health of people, but it's also about the economic development that can occur in a community when you come together in partnerships. And I thought about all the abandoned spaces that there are in urban centers and all across our communities, wherein if we could create and sustain these kind of partnerships, they could actually create meaningful change in the community. I think I read that it was 32 acres. I mean, so it's like a huge mall. So if you go to Jackson, you have to go to the Medical Mall. In fact, there's a website, I think it's just www.jacksonmedicalmall. But look it up and see what one community did, and it really represented the vision of one man to create change in that community. So I want to say that if you receive also a call from 919, that's my area code, so don't ignore that call. It's me, and you are my new friend, and I either need something or I think there's an opportunity for us to work together. So Shauntice, I actually forgot one thing. Would you bring me that bag? So a little about CCPH, Community Campus Partnerships for Health. And so I'm to touch only one button, is that correct? Right, so she told me to touch one button and one button only. I'm touching the button, oh, there we are, okay. She said one button. I said, never tell a child to do that, right? And she said, and this button right here, this is the one that you're not supposed to touch. And I'm saying, this one right here, you mean this one? So I want to talk about Community Campus Partnerships for Health. So our mission is to actually promote health equity and social justice through partnerships between communities and academic institutions. And can I say that my whole idea about partnerships is evolving over time? I actually believe in partnerships. In fact, I believe that you can't really get anything done unless you work in partnerships with other people. So I will say that this whole notion of community campus partnerships is not just something that is present here in the United States, but it's also a global trend. There's a report that was put out recently by the United Nations Task Force that entitled Global Trends in Support Structures for Community University Research Partnership Survey Results, which highlighted partnerships that are occurring across the world, around the world, to address very critical health issues. But one of the things that this particular report highlighted is the fact that partnerships really should be focused on creating social change. And so the real merit or the real worth or value of a partnership is to create change. This means not maintaining the status quo or business as usual or supporting social injustice. This work is really about a movement. And I feel that partnerships can really help to sustain and create those types of change in our community. Just like I described the Jackson Medical Mall is, to me, a movement towards creating community-based services and community-based presence to create meaningful change in a community. The statement around social justice and health equity that you saw a few minutes ago is really about creating change in America to address some of our most pressing and important issues. And so for almost 20 years, CCPH has been a leader in advancing authentic partnerships that build capacity, generate knowledge that directly benefit communities, influences public policy that affects the health of all people. So we define health very broadly. We don't think about health as just being physical health. And some of you have seen the World Health Organization definition of health, talking about the fact it's not just the absence of disease, but it's more than that. And what you heard this morning is really about creating a culture of change that not only addresses the whole issue of helping to increase the number of minority physicians that are practicing in this country, but also changing communities, because you can think about the fact that if we can work collaboratively through partnerships to put young people on a trajectory towards success, that will actually create change, lasting and meaningful change in our communities. So I want to say that as the new executive director, I am not ashamed of asking you, begging you, pleading with you to consider joining Community Campus Partnerships for Health. We have institutional membership, but we also have individual membership as well. I have placed on the table outside information about community campus partnerships and some of the brochures that we have as an organization. And so on your way out, I would certainly encourage you to take advantage of picking up that material and giving us a look at and consider joining our organization. We advocate for promotion and tenure policies that recognize the scholarship of community engagement. And so a lot of our work has focused on really helping academics who are engaged in community work to be able to integrate that information and that material and their work into their tenure track package, and to actually use the material on our website, which is, by the way, free. And you can use that in helping to really pull your package together and helping you in terms of obtaining tenure and promotion at your academic institution. CCPH advocates for changes in policies by public and private organizations to support the engagement of community leaders in research. And this conference today that you're having really is an example of, I think, a decision by UAB to actually make sure that the community is fully engaged and fully invested in the work that's occurring in this community, but also throughout the region. CCPH has advocated for the adoption of policies to create and sustain equitable partnerships in community campus work. Our principles of partnership serve as a conceptual framework and roadmap in creating policies that support both the community and the campus. So when we think about community, we often think about some obvious communities, but for us, community has a really broad definition. And so I'll just kind of walk and talk, maybe can walk and talk, and maybe not walk and talk, I think, because if I do that, you can't hear me. So when we talk about defining the community, we have a real broad definition of community. But importantly, central to this whole idea of community is we ask ourselves 4 questions. And the first question is, are those most affected by the problem at the table? That's the first thing we ask in terms of creating a community. Are those most affected by the problem at the table? If the answer is no, then you don't have community. It's just that simple. Number 2, are those who have a stake in the issue being addressed at the table? Are they engaged? Are they at the table? Yes, no. If no, you don't have community. Number 3, are those with the resources, the knowledge, the connections, the funding needed to address the issue at the table? Yes or no? If no, then you don't have community. Now this third piece is real critical. See if I can do this. Here, yeah. This third piece is real important. Okay, got it. Because nothing can be done without the resources. All the vision in the world and all the ideas in the world mean nothing if you don't have the resources to execute it. And I've worked in community-based organizations for over 25 years, work with them, still work with them and support them. And quite frankly, I'm going off script here, but this is the point that really hangs most of them up, is you have to have the resources to do it. And so we cannot see the philanthropic, the academic community, and other communities or organizations that have the resources as being an enemy. We have to work in partnership with those groups and those organizations and bring them to the table, because they really help to create community. And without them, you have nothing. So again, the Jackson Medical Mall, all the visioning in the world would have meant nothing if you couldn't bring the right people to the table to, number one, purchase the property, build the infrastructure, hire the people, and keep that program moving. And it will mean nothing in the future if you don't have the resources to make it happen, and that's community. So the fourth point is, do they play, here we are, there we go. Do they, hit the wrong button. There we go. Do they play decision-making roles? Again, this is critical. So not only are they at the table, do they have the resources, are they affected by it, but what is their role as it relates to leadership in that? So that really gets to the whole issue of governance. And so I remember when I first started working in community health and people were talking about governance, I thought, what is that? It's really about how the organization does its business. It's about who leads the organization. It's not only just about who leads the organization, but how are decisions made? So what you may decide is that there may be a co-leadership role. So there may be a co-leadership role in terms of having an academic lead and a community lead. Or you may have 3 chairs, right? And all of that. So how do you resolve differences? Because differences will come up in any partnership. How are those decisions made? And if you need, the resources, then the governance to be able to lead that organization and that work forward. And again, thinking about just the experiences I've been in, this is a spot that hangs out a lot of people there, right? In terms of making sure, I hit the wrong, yeah, they're still there. That you have the right people at the table, but also you have a structure that leads them. And so if you're part of a community-based organization, if you're part of a community effort, spend some time thinking about the governance and how decisions are made, how issues are resolved within that organization. But there's a 5th piece that I've added. I hadn't added it to this yet because I've been thinking about it, and that is what happens in the situations where people don't even know that there is a table. And that occurs a lot of times. My former boss, who's an amazing person, and she's like about this, and she's kind of like what you were describing this morning. It's like, I think when I met her, she was maybe 5'4", and now I feel like she's a little bit smaller over time. But she would look up to me and she would say to me, she says, "Look, Al, you need to go to that meeting." And I would say, "Yes, ma'am." And I would say, "Well, why is it so important for me to go to that meeting?" And she would say, "Because there's going to be pie at that meeting." And she knows I love pie, right? I mean, come on. And I said, "Well, what do you mean there's going to be pie? What kind of pie?" She says, "There's going to be a money pie." And she says, "They're going to divide that pie up, and you only get a piece if you're at the table." Think about that. So decisions are going to be made, decisions about governance, decisions about leadership, but also decisions about resource allocations are going to be made. And if you're not at that table, you don't get a piece of the pie. And the councilwoman knows that, and she says, "Amen." Because that's how decisions are made. That's the politics of decision-making in a democracy that sometimes is very flawed. But the piece there is that's important is helping people to understand that there is a table and that they need to be at the table. And that means attending meetings and being a part of the process even when you don't feel like it. And staying in there and hanging in there long enough to get what you really do want. You may not get everything that you want, but I can guarantee you that if you're not at the table, you won't get anything. So think about that. When I think about the work that we do around communities and defining communities, I think about the fact that I connect social change to addressing social injustices that occur all too frequently in our communities. In every respect, social justice is not what you say, but it's about what you do. So Community Campus Partnerships for Health, we advocate for social justice. But what does it mean? Because it's not just what you say. Again, it's about what you do. The civil rights movement in the 1960s was advanced through actions, not merely talk. The movie Selma depicts with painstaking accuracy what occurred at the crossing of the Edmund Pettus Bridge. But it wasn't about just talking about crossing the bridge. It was the fact that black people, white people, believers, non-believers, people of faith, people seeking faith, made the decision to cross that bridge. It is always about what you do, not about what you say. All of the presentations that you've heard this morning, and even the work this morning about the Three Doctors Foundation, that is about social justice. It is about shifting and changing a paradigm in this country. It's about creating a culture where young people embrace education in the same ways that they're embracing popular culture. It's about changing the mindset of people and thinking about the fact that, you know what, I can succeed. And so, you know, it would have been great for the Three Doctors to just say, you know what, I've made it, we've made it, and that's it. But their commitment to social justice is about all of us making it and bringing up other people as well. The work of community campus partnerships is about real people living with the most challenging issues and conditions of our time. And so for communities around the world, this work is not academic, but the daily struggle to survive. And that's, again, something to me that I don't want our organization to forget. And that's why I came to Mississippi and Alabama, because I wanted to make sure that I was reminded of the fact that this is about real people. You know, we can't just work, even though we work in a virtual operation, I think we have to be more intentional, quite frankly, about making sure that we don't forget the people that this is all about. We exist to improve the lives of people. We exist to address real issues of poverty. We exist to address real issues of the fact that people are walking the streets because they feel hopeless. They feel they have no hope at all in this country called America. And so we have to make sure that the work we do has real impact, and that's a paradigm shift. Because quite frankly, the work that we do could be just academic. You know, so we could set out these principles of partnerships that I'll talk about, but they won't mean anything. Because, you know, the way I look at it is that I'm here for a reason, I'm here for a purpose, I am who I am, and I bring to this work my own personal lived experiences. And my lived experience suggests to me and say to me and really lead me to make this work very real. Because at the end of the day, when I'm finished with this work, I really do want to know that I've done my best with this work. So for the past year, I've been on a journey to more fully understand and live out social justice in my own life. And I think that the whole issue of social justice, and as an organization, we're going through this process wherein we realize that it's, again, not just a concept, but it's also something that starts within you. You have to explore within you preconceived ideas that you have regarding other people and even about your own self. So if you've been following me in CCPH, our e-news, I've been detailing books that have really changed my thinking about social justice and are helping me to evolve. And I want to highlight a couple of those books, and I want to share another one with you today. The first one is a wonderful book that's called A Call to Action, and it's by President Jimmy Carter. If you've not read this book, this is an amazing book where the president talks about how sacred texts have been used to denigrate women, and that the problems that we see even with sexual abuse on college campuses really comes out of the fact that sacred text has been misused for the purpose of actually denigrating and subjugating women. And I really applaud President Carter for making that, because quite frankly, when I read that book, I first heard him on NPR talking about it, and I picked that book up. And I oftentimes talk about, as a Black American, about my challenges and my struggles. But it was his book that really made me think about the privilege that I have as a man in the United States. The fact that I can walk most streets, I'm not concerned about my personal safety. I can leave this building at 9 o'clock at nighttime, and I'm not as concerned about my safety. But most of you that are female would be very concerned about your personal safety. That's the privilege that I have, right? By just being a male. We talked about this morning, there was a question regarding the inequity in pay and access. And so Jimmy Carter does an amazing job in a call to action to bring attention to the fact that we must do more to address the issue of really elevating and honoring women in our culture. And he talks about his own mother and his wife. You know, he's made some decisions that were not popular with everyone. He and his wife, Rosalind, made the decision that he was attending a church and they would not allow women to serve as deacons. They left that church. To them, it was that important. And if you know anything about Jimmy Carter, it was a church that he and his family had been members of for years. But they felt like they could no longer sit in a place where his own wife would not be recognized for the gifts that God placed on the inside of her. The second book is a book called The Dignity of Difference by Rabbi Jonathan Sacks. This is an amazing book that really explores the whole phenomena of globalization of the world, and talking about the fact that we must embrace the differences that exist between people. Because if we don't embrace the differences of people, then it really creates anarchy in our society. That we must embrace each other for who we are. It means that we don't assimilate, but we accept people for being exactly who they are. And quite frankly, I believe that the Pope did an exceptional job last week in talking about the fact that we must recognize and honor the difference that we all bring to the table. The third book is The New Jim Crow by Michelle Alexander, a must-read, an eye-opening probe into why we really have created this school-to-prison pipeline in the United States, and around inequities in our sentencing in the United States, and why we're building more prisons than we're building schools. And so if you've not read Michelle Alexander's book, it's a must-read. And then the fourth thing that you just absolutely must experience is the movie Selma, because it really lays out the struggles and the challenges of people towards social justice. And quite frankly, it's not just Black people moving towards social justice, but it's about all people moving towards social justice. And the more I read and the more I grow internally, remember, social justice is an internal work. It's not external. And as you explore and you read, then you grow as an individual, and it challenges your own conceptions and misperceptions about other people. So all of these books and this movie really has global implications. It may be sex trafficking. And so Sonny spent some time talking to me about sex trafficking. And it's a critical issue. It's not just an issue for women, it's an issue for men. And as I read again the book, A Call to Action, that's the one book that really brought my attention to the fact that sex trafficking exists in this world, that it is slavery by a different name. And that we must address it because it impacts people, because people are innocent and they're engaged in these kinds of activities wherein we have a punitive nature, and that is to arrest the women that may be engaged in prostitution, but we do nothing to the men that pay the money. So I'm really off script now. So authentic partnerships are about social justice. So that's where, and that's the direction we move. We can't say it enough, but this work must be about social justice in our communities. So I talked about defining our communities and all of that. So I want to spend a moment here talking about our principles of partnership, how we believe you ought to do this business in terms of creating change. So we've laid out 11 principles that really guide the work that we do as an organization. There's some bookmarks out there, and if you go to our website, you will see this information there. And it lays out with, in detail on our website what these principles really mean. And this is how we do our business, and this is how we believe you should operate. And so we've also created, these are some of the principles. I won't read them. I want to go to this slide that talks about the elements of an authentic partnership, because this really kind of wraps it all up. And that we talk about, now notice I keep using the word partnerships, but I also use the word authentic partnerships, because sometimes you have a partnership, but it's not an authentic partnership, right? It's a partnership on paper. It's a MOU between two organizations or 3 or 4 or 5 organizations, but it's not an authentic partnership. And so what we say that it can only be, it can only be a true authentic partnership if it has these critical elements to it. First of all, it has the principles of partnership. Then it has quality processes, meaningful outcomes. It has to be about something. We're not just meeting at 7 a.m. for breakfast because we love sausage, eggs, and grits, and I love sausage, eggs, and grits. I love them. I think they are God-given. And everyone should experience sausage, eggs, and grits. So let me tell you, one time, my first trip outside of North Carolina, this is when I'm off script, right? So my first trip to Oregon, I was like in high school, and people said, well, where are you from? You know, so I do have a Southern accent, but I really made it real deep, right? I'm from North Carolina. And they said, and I said, and so we started talking, and they said, yeah, I said, and we eat grits for breakfast. And they said, grits? What are grits? I said, well, grits grow on trees. And every morning, people in North Carolina, they get up because most people have grit trees. And they go outside and they just pick some of the leaves off of the grit tree, and then they bring them inside and crush them up. And then we eat them for breakfast every morning with eggs and some sausage and some biscuits. And they said, oh my God, I can't wait to visit North Carolina and see those grit trees. I said, just let me know when you see one. And so I probably have some friends who I met like 35 years ago are still coming to North Carolina, South Carolina, Mississippi, Alabama, and Georgia looking for grit trees. But I thought, if you don't know what grits are, then I might as well tell you that they grow on trees, right? So I can't explain to you that it's ground cornmeal and all this stuff. But anyway, so grits grow on trees. So you can tell people that grits really do grow on trees in Alabama. So I forgot where I was. All right, so I was talking about breakfast, right? So I was talking about breakfast and with sausage, eggs, and grits, right? So it's not about just having sausage, eggs, and grits and biscuits for breakfast, or as my cousins say, biscuits. And so it's not about that, but it is really about meaningful. But then the last thing I want to bring your attention to, it is about transformative experiences. So the authentic partnership is about transformation. The Jackson Mall that I keep talking about, because that was the thing that really kind of resonates with me right now, has created transformation in the community. And so whatever we do in terms of our partnerships, think about this and ask yourself these questions. Again, who's at the table? Are the people with the resources? Do people even know there's a table? Are we engaging people as it relates to the principles of partnership? Are there quality processes? Are there meaningful outcomes? And really, is it transformative? So I meant to say from the beginning, I want you to tweet use our hashtag to tweet, but do not mention grits when you hashtag, because it's important that people know that I came here to say something more than just talk about grits, right? So our hashtag is at CCPH 2010, I think that's what it is. At CCPH 2010. So, but don't talk about grits. Talk about quality processes and principles of partnership. Don't mention grits, right? So our policies and our practices must move us again away from the objectification of people based on their sexual orientation, based on their religion, or anything else that really serves to create people and move people and marginalize people as being other. I want to talk some about what I see on the horizon, or even present with us now, is 3 issues that CCPH is really concerned about, and I would suggest that these are issues that I would encourage your partnerships to address. The first is racism. It's very clear in this country that we have to do more, must do more around racism. And it's not an easy topic to talk about sometimes, because I'm with friends. I'm an African American leading an organization, and that's not easy. And sometimes I'm concerned about, do people see me for who I am, or do they see me simply based on the color of my skin? And so racism is real. And we see how racism gets played out. And so after the massacre in Charleston, I said, when people said racism doesn't matter and it's gone and you can forget it and it doesn't really hurt people, I thought, really tell that to the families of the people in Charleston. Racism kills. These isms, racism, sexism, elitism, classism, all of them, they kill and they hurt people. At the very least, they reduce people to something that they aren't, and that's less than human. And that's really what President Carter was really talking about in his book, because he believed that the Bible and other sacred texts really elevate and lift up women, and that our society must do that. So it's not about an easy fix, but we really must address racism. The second issue that really concerns me is around wealth inequality or poverty. And we have a growing gap, and we must address that. So those of you who live in this region, you know that there's a difference between wages and income and the quality of life and resources here. You can do the same job in New York and get paid much more than you would here, right? So there's wealth inequality that's regional. And again, we must do something. And I think partnerships are, if we design partnerships in the right way in terms of with looking at these different kinds of issues and elements, then we actually begin to address issues around wealth inequality. And the third issue is around immigration. We must do something around immigration. And last week, the conversation of immigration was elevated. The crisis in Europe, the crisis in the Middle East demands that nations globally, the United States cannot sit in isolation. We exist in a global world. We exist in a global society. And what happens in one country reverberates to another country. We saw that, when during the kind of the meltdown, and I thought I was kind of immune to that until I got a letter from my credit card company, I guess 6, 7, 8, 10 years ago, and said, look, we're stopping your credit. I'm like, what? I was thinking that was other people and it wasn't going to affect me until they told me I couldn't use my credit card. Did that happen to you? Did that happen to anybody else? Or was I'm the only one with bad credit or something? What? Am I the only one that happened? No one else got a letter? They're not willing to admit that they got a letter. Okay, thank you. I was thinking it was just me. Okay, maybe it is me. So anyway, I want to just say that CCPH defines health certainly very broadly. And this then allows us to be concerned about what we call upstream issues. You keep hearing people talk about upstream issues. I'm like, okay, some people not even in the stream, but anyway. So upstream issues, which means the social determinants of health. So, a good preacher always, and I'm not a preacher, but I'm looking at one person that really is enjoying what I'm saying. So the rest of you that aren't enjoying it, it's okay, because I got one person out here who's saying amen, and I feel really, I'm going to preach to her, right? I'm just going to target to her, and then I'm going to pass the offering, and then I'm going to sit down. Pass the offering plate and sit down. But anyway, so we define health certainly very broadly. And so we believe that authentic partnerships must be about authentic issues. When they don't, it misses an opportunity to really make meaningful change and have positive impact. So most of us, I think, would agree that racism, wealth inequality, and immigration are authentic issues. So if we have an authentic partnership, we need to be speaking about and addressing authentic issues. I support partnerships that support the preservation of native languages through teaching different languages to young people. This in turn sustains culture that then sustains community that could lead to better health outcomes. So we must also address public policies. I wasn't concerned as much maybe 10 years about banning the box, but I'm very much concerned about banning the box, because I believe that we've created this system wherein we ask people, are they felons, knowing full well that there's a large population that really does. People cannot get ahead if they can't get a job. It's just that basic. It's just that simple. And so we really do need to do more around banning the box. Because then if we can get people working, we can get people employed, then hopefully we can improve their health. So again, health is not about the absence of disease. It's about all of these other issues. I want to take a moment to just read something. I'm reading a new book. I'm part of a leadership program, and the best thing about that leadership program is really that they require a lot of reading. And so the latest book I'm reading, sometimes you don't read unless you almost kind of have to because part of a class, and so I appreciate it. So I'm reading a new book by Parker Palmer, and it's called Let Your Life Speak, listening for the voice of vocation. And so in closing, I want to, and your preacher tells you that, and he goes on for 15 minutes, right? so anyway, you're like, okay, I thought, hey, dude, wait a minute, I thought you said you was closing. Ending, I gotta go somewhere, but out of here. So when I think about all of this work, I think about leadership. And Parker Palmer says this about leadership, and I want to leave this with you. Leadership is a concept we often resist. It seems immodest, even self-grandizing, to think of ourselves as leaders. But if it is true that we are made for community, and we're talking about community today, then leadership is everyone's vocation, and it can be an evasion to insist that it is not. When we live in the close-knit ecosystem called community, everyone follows and everyone leads. And so I want to challenge you today to be a leader in your community, to engage in authentic partnerships and make a difference, because all of you are leaders, not just the president, the executive director, the dean, faculty status, community leaders, but all of you are leaders, and influence your community, because it's not just kind of a hobby that you do, it's really who you are as a leader. And so embrace the idea that I'm a leader. I can create change. I can facilitate change. I can be an agent for change to do better in my community. I talked about Booker T. Washington and George Washington Carver. Two men, but individually, they changed the world. I submit to you that our speaker this morning is that kind of a leader who in his own way is changing the world and making a difference. Be a leader and change the world. Thank you. Thank you, because I know you don't stand on Sunday for your pastor, so you may be seated, okay? So a little humor can go a long way, I've found.
All right, thank you so much, Al. We're going to open up the floor for questions. It's about 1:15, and we're going to do about 15 minutes of questions, and then actually Dr. Davis has got to get to the airport, so he's going to be leaving in about 15 minutes, and I want people to be able to say their goodbyes to you, but we'll take a few questions from the floor at this time.
Good afternoon. My name is Beverly Berry.
Hey, Beverly.
So my question is about this pie that's at this table.
And mine is over there waiting for me, okay? I told you I like pie.
I like pie too. So my question is, where do you seek out this pie? Like, what organizations or what steps would you recommend someone taking to kind of seek the pie? Because you know it's out there. It's just a matter of connecting and partnering with those individuals. So where would you recommend to start?
Well, as part of that answer, let me just say is for me, so I'm seeking out the pie for my organization, right? So part of my trip this week is to actually identify people who can help give me a piece of pie. The serving of pie always starts with a relationship. Never forget that. Honor that. People will never divide their pie up with you if you don't have a relationship with them. You have to foster and build a relationship. And you have to have that relationship with people, not just when you want a piece of the pie, right? It's hard to establish a relationship with people when you're in a desperate financial situation, okay? If I know you, I might give you some bus fare. But if I don't know you, it's gonna take a whole lot to convince me to do that. So what I'm saying is that, there are places where you can look. The United Way, there are local foundations that are involved in distributing pieces of the pie. But again, what I've been doing for the last year is actually meeting with people and sitting down with them and talking about what I need. But I also understand that you have to understand how that organization operates. You have to understand the parameters. You have to understand what they're looking for. We've been talking to Robert Wood Johnson Foundation about some money, but I have to understand that what Robert Wood Johnson Foundation is committed to. Right now, they're committed to culture of health. Your work has to align itself with the organization or the foundation. So I would actually say spend some time doing a lot of homework, researching most stuff is on the internet. Spend the time doing that research and finding out more about what they want. The dean is here and he's helped to shepherd many, many proposals through NIH. And the key thing is through helping to understand what NIH is looking for, having conversations, and don't be afraid to have a conversation. It all starts with the conversation. One of my board members says, speak up even when your voice is shaking. You've heard that before. So open, call, send an email and say, I'd just like to sit down with you and talk about what we're doing on the east side, west side, north side, south side. Hear what we're doing in Birmingham. And I want to sit down and see if there may be an opportunity to partner. And one of the things I'm taking away from this experience, use the word partner. Say to people, I want to partner with you. That's a whole lot more palpable than it is to say I want some money from you, right? I want to partner with you. Next time you go in to talk to a foundation, say to them, I want to partner with you because I believe after having done some research, we have some shared interest. Our interests and our concerns around youth or around HIV and AIDS or around economic development.
Hi, my
Hi.
name is Naisha Black.
Hi, Naisha.
I firmly believe that health inequalities are economic inequalities.
They are.
And as a person, I'm a researcher, and I'm also, my research is informed by a variety of disciplines. And we realize now that we are entering into a new economic transition. We've gone through the agricultural economy, the industrial revolution, now it's the technology. And there was a piece in the Atlantic a few months ago written by Derek Thomas called The End of Work. How will technology will essentially get rid of millions of jobs. So given that health inequality is tied to economic inequalities, how can us as researchers and as people who are involved in the community be very strategic about our plans for tackling health inequalities in the future?
So I think that it's going to require interdisciplinary approaches. So as you address health disparities, you have to also deal with job creation. And so, like one example, just an example, wherein you're working with young mothers. Can you take those same young mothers and actually help bring someone from the School of Business or communication to help them to learn a skill around the new technology? It also about talking about bringing people in from the School of Business to work with them around entrepreneurial efforts to create their own business, around coding, around software development, and all of that. I think we have to get in there and help people understand the changes and the transitions that have occurred. And I agree with you that I think about when I first started working 30 years ago, they had in state government in North Carolina, they had these large typing clerical pools, right? None of you are old enough to remember that, but they just had like hundreds of people. You remember that? Like people just sitting at typewriters, typing all day long. And you would write stuff out in longhand, and then you would put it in a little basket, and it would disappear. And then a couple of hours later, it would reappear, right? That doesn't exist anymore. People don't need secretaries like they once did. People don't do shorthand, all of those things. So I think you're absolutely right that we have to be aware of that, but also help our communities understand that, you know what, you need to think differently about your career, and we want to work with you. So it's not just a School of Public Health or a Department of Epidemiology working, but it's always working within the community, but it's also bringing out other disciplines to help people understand what they need to do to be ready for the current changes. And in fact, unfortunately, I think so many of them are already so far behind. So it's not even about trying to get ahead of it. I mean, it's really trying to maybe play catch up a little bit, but it is critical, and I appreciate you saying that. But that's why I think you're seeing people talk about interdisciplinary approaches, because it's going to take that. It really is. Well, thank you. I'm ready for my pie. And it's over there, and it's calling my name. And so thank you, and pick up a copy of this book, Let Your Life Speak. I don't get any royalties from it, but I think it would inspire you. Thank you.
All right, Al put us ahead of time. I like that. It's now time again to transition into the breakout sessions. There are 3 of those for you to choose from. And again, refer to your program agenda for more information on those sessions. Directly across the hall, A, B, and C corresponds to A, B, and C in your agenda. Session facilitators and moderators will set up the structure and explain the format of the discussion format once you've settled into your respective rooms. I want us to all make sure that we give Dr. Davis another hand as we get ready to leave for the airport. And also, please make sure, again, as you're moving through the day, that you are completing your evaluation. This is very helpful to us as we're thinking about the 2016 Community Engagement Institute. So I hope that you enjoyed your lunch. Next round of breakout sessions across the hall. Thank you all so much for your time. And again, thank you, Al, for those wonderful words. We appreciate you.